everybody, and welcome. My name is Jose Gaona, President and CEO of Zeta. We are so excited to have another one of our amazing conversations this month. This is our Tech Talk for December. We're so excited to have you join us today. I will go ahead and preface this entire conversation by saying that I am sick again. So I will be sniffling a little bit during this conversation, but that does not take away from the value, and it adds to the reality of what we're talking about today, which is health, telehealth, and health innovations that are shaping our world today. Tech has transformed nearly every sector of our lives, as we all know, and healthcare is no exception from that. From virtual care delivery to data-driven decision-making, telehealth and tech-enabled health services are reshaping how care is accessed, delivered, and experienced. These innovations hold significant purpose, not only in improving efficiency and outcomes, but also in expanding access to care for historically underserved or not served communities, and redefining what patient-centered care looks like in the digital age. To help us examine these shifts and their real-world implications, we're joined today by a wonderful panel, two amazing individuals who are working at the forefront of telehealth, artificial intelligence, and health innovation today. First, I'd love to introduce David Goldsmith, Chief Operating Officer at Survivor Healthcare. David is helping lead the expansion of a virtual clinic dedicated to improving outcomes and quality of life for cancer survivors. His career spans technology, healthcare, and philanthropy, with leadership roles in growth, strategy, and product innovation. Through his work, David has focused on designing patient-centered systems, expanding access to supportive care, and advancing digital models that create value across the healthcare ecosystem. Next, I want to introduce Dr. Omar Castilla-Reyes, Founder and Chief Executive Officer at EQ Healthcare, a leading AI scientist and innovator. His work integrates neuroscience, advanced machine learning, and behavioral science to develop neurosymbolic explaining AI systems designed for clinical credibility and human-centered design. At EQ Healthcare, he leads a team focused on translating fragmented health data into coherent, privacy-centric intelligence for both individuals as well as organizations. His research and entrepreneurial efforts have been supported by Google Research, Microsoft Research, NVIDIA, and the National Science Foundation. We could not think of two better individuals to have for this conversation today. And we were just talking about the irony and having me be on camera here, sniffling away, but truly, David, Omar, really, really excited to have a conversation with you both and to shed light on something that we have been exploring for the last few quarters on Capitol Hill with our policymakers who are rapidly trying to stay in the loop and ahead of so much development happening in industry at this intersection. So thank you both for joining us. How are you all doing today?
Much better than you, apparently, Jose. So Thank you for having us. Doing well.
Yeah, you know, all things considered, I can't complain. I'm looking at a great view of New York City, and I'm about to have a conversation that, believe it or not, I really have been looking forward to having, because there is so much curiosity surrounding this area of work in the conversations that we have on the Hill. Omar, you were actually just on the Hill. Before getting into the conversation, I want to talk about how our paths intersected in DC. What's it been like for you to kind of jump into that space in DC and expose yourself to some of those questions our policymakers do have?
Yes, so I was at the Hispanic Tech Conference in DC, and there is a lot of talk regarding healthcare innovation and how can we make a difference. So as you might all know, healthcare is just getting more expensive, more complicated. Insurance premiums are going up. People cannot get appointments for primary care. When anyone gets in the hospital, you don't even know how much you're going to be charged for. So the problems are infinite, right? So as someone from MIT that spent there almost a decade, for me, this is the thing that has to be fixed. And one of the most challenging spaces, because it's so complicated, but it's exciting. As someone from MIT that likes challenges, I feel that this is exciting. It is a really
Yeah.
exciting space.
Yeah, I want to paint a bit of a picture there, going into kind of our first area of questioning here. We know, and we've seen it, I think, as patients, that there's been a somewhat of a gradual transition, right? We've seen computers and digital technologies kind of always eventually go into our health experiences as patients, right? I'm on the older side of the Gen Z, and so like I remember kind of seeing that infrastructure development grow around computers being a part of your appointment systems that you were working with, analyses and results coming back digitally as opposed to over the phone or in person. I saw kind of that transition, but what we're talking about here in telehealth is kind of this next big step where we started to see those virtual consultations, right? The tech nerd inside of me wants to reference our transitions from like 3G to 4G to 5G, giving us that capacity to do that kind of video engagement, right? Over this, like what we're doing now, and that being kind of then the foundation needed to build telehealth services on. But it has been rapidly evolving, even though technology has always been integrated there. I'm curious to kind of dive into this first area of how did we transition, or how do we even identify that transition from physical care to tech-enabled care? Something tells me that's not a very clear-cut answer, because I think it really just depends on kind of what your marker is that you're identifying for tech-enabled care. But
I can try to give you a short. Sorry about that. I mean, maybe
yeah,
David.
I would love to get both of your thoughts on that, right? What marks maybe the first major milestone in tech-enabled care, and then what that transition's been like with these video-enabled telehealth services.
Yeah, so telehealth has been around for a very long time. So telehealth is not new. So the thing that we need to understand to really put it in framework for where we are today is that the push for telehealth was essentially made for COVID. So COVID was the event that really pushed us to search for that kind of connection, right? Because telehealth providers have been around for so long. But the problem also was reimbursement, right? So the government and the insurances would not reimburse anything that would be telehealth because it's not personal. Before COVID, not everything that was here like us. They were like, okay, so it's not it's not in an office, in a clinic, so we're not going to reimburse you. So there was no incentive, right, at all to do any kind of telehealth. But then COVID came, COVID hit every one of us, and essentially we didn't have anything else to rely on to see our doctor, right? And that was essentially the push that transitioned us from this in person to more telehealth. But I just wanted to put a bit in framework, so maybe David has something else to say. But this is the reality of telehealth.
Agreed. I mean, I think it's hard to overstate how critical COVID was as a catalyst for telehealth. It certainly was critical in terms of the payment and reimbursement models that you're referring to, Omar. But I think that it basically enabled us to see that we could provide high quality care without it being in a physical location like an infusion center or a hospital or an outpatient clinic. That essentially with these tools, we could get in front of patients wherever they were. kind of overcoming that sense of this being the healthcare being location dependent, I think was just critical in 2020, and it continues to be today. If you look at it in the context of cancer care, which is where we are, or even in terms of some of these more complex, chronic health conditions, it didn't really start out as a convenience. Telehealth was less about being a convenient solution and more about how to add capacity into the system. Again, if we think about it in the context of COVID, one thing that was very evident is that clinics were overwhelmed, and a lot of people who were, for example, immunocompromised, didn't want to be anywhere near a hospital or clinic if they didn't have to be. So, especially even more so if they had to travel long distances and with any kind of immunocompromised system. So it became at that point a way to add a lot more capacity into a system that was, of course, really tapped out. Some of the early telehealth models I think we've learned work best when care was intended to be sort of provided in a longitudinal way over a period of time, as opposed to being purely episodic. So if you were monitoring a patient, again, with a complex condition, possibly post-operatively, there was an opportunity to use telehealth to ensure that on the clinical side, that we were getting the patient in front of us. We were seeing how that person was trending, whether they were essentially staying the same, whether they were losing ground. Hopefully they were gaining ground. These were things that you could actually see by talking and learning from the patient in a virtual setting. And it also kind of reinforced that a lot of the care really could be conversation based. It wasn't procedure based. It was, tell us how you're doing, and then we'll determine whether we need to see you in a clinic or not. I would just add quickly that probably the most critical breakthrough was less about, something like video, which we always thought was sort of the critical issue. And on the clinical side, it was really more about workflow integration. Enabling clinicians and hospital systems and others to schedule, visits across numerous disciplines, building, making it easier to get the documentation that was needed across these different care settings into the clinical record, and facilitating more handoffs between teams. So that integration really, again, once that was starting to get addressed, I think facilitated a whole new wave of growth and traction with telehealth.
Yeah, that's really interesting. I think for patients, you don't always immediately start to think about, those tasks that are associated with bringing in this new avenue to engage patients. It speaks to some of the barriers that we run into as we're trying to expand, or even during the pandemic, kind of active period of the pandemic, when we were in a rush to then kind of build in these new pathways, to your point, David, to provide additional avenues for which folks who are immunocompromised or just were not comfortable going into or couldn't into these hospital settings to be seen, right? I'm curious to know, because from the patient perspective, or from someone who's not in that space's perspective, I remember hearing initially as the pandemic kind of started to grow, like these conversations around, like you can see your doctor online. I had heard of folks who were doing like, therapy over the phone or therapy over a Zoom call. Maybe not before the pandemic. I don't know if I actually had heard of Zoom before the pandemic, so don't quote me on that one. But I remember folks, to some extent saying like, there's
came, everyone was on Skype, and now
on Skype. Oh, okay. Yeah, no, I don't know what happened to our friends there at Skype. But that's interesting, right? Because from a user standpoint, I think there were some thoughts around it. I don't know if it was like very popular, But immediately, right, like as we were kind of hit and all were hunkering down at home, it became this kind of thing that we all understood, like, oh, you can make a virtual appointment now, like this is what we're doing. And it was a little clunky, if I remember correctly, as folks were getting accustomed to it, but it was out of necessity. You've talked about some of those barriers that folks that are setting up this infrastructure, dealing with this patient onboarding, were going through. What other kind of barriers or immediate kind of shifts does the public not necessarily know that our healthcare system had to take into consideration during the pandemic for all of that telehealth service? That's an open question to either of you.
I mean, I can add a little bit more to that. So it's complicated for everyone, right? So it's essentially changing the way we work, right? So as healthcare system, right, and also how we behave as patients. So I'm also a patient and also kind of like a provider of health, right? I mean both sides. So as David said, so is all about integration, right? So we as hospitals, or we as providers, work essentially day by day by certain patterns, right? And sometimes technology, the problem with technology is that you're essentially breaking the way people work, right? So they kind of like, they're used to doing things a certain way, and you came with a technology and that disrupts workflows, disrupts schedules, disrupts how nurses report. So I think it's a very complicated problem, because if you are trying to bring any kind of technology, not only telehealth, like integrating it into this complex ecosystem, it's a very, very big challenge, right? And I don't think that the startups really think about that deeply, or anyone that is doing tech, because you're essentially changing a lot, right? For example, I have a colleague of mine that he works from home, right? So it's kind of like telehealth, but he controls a robot, so he's a physician. And he goes, so what happens is that a nurse in a hospital carries a robot around, and he's in the screen. He's a neurologist. So what he does is, like, he's in his home in Texas, but the robot is being controlled anywhere in the US, by nurses. And the robot has to be taken to the patient, and he asks questions. He said that to the nurse, do this, do that. So so I think that, and it works for him, right? So that technology is integrated in such a way that the nurses know how to operate the robot. He knows what to say. He knows, so. But I can imagine it was not easy at the beginning, right? So that's one example, right? That I believe a successful technology, but maybe there are some problems, I don't know. But so that's just one. But that happens with thousands of other technologies, right? So they want to integrate it, but sometimes they disrupt so many workflows that actually is more of a burdensome than help. And hospitals don't use it, right? So doctors don't use it, and nurses don't use it. So I believe that integration is key, right? So really having that integration mindset.
Right. Of course. Yeah. David, I don't know if you'd want to add anything to that.
Well, the one thing I would just add on the patient side is that it's, despite the fact that we've made considerable progress in terms of how ubiquitous the technology is, and increasingly people with better access to bandwidth, even in 2025, we still have significant access issues in rural communities across the country, where the infrastructure remains very substandard in terms of what many of us have access to in urban areas. It continues to change, of course, but not at the rate at which I think any of us would like it to. And so, for example, in our clinic today, we will still on occasion be, I would say it's roughly between 5 to 10% of our patients who are in rural areas where the bandwidth is so limited, a video telehealth call is very disrupted. and then it becomes a distraction, right? Because you're trying to have a conversation. It can be frustrating and distracting. And so, fortunately, with telehealth reimbursement today, you are able to get reimbursed for an audio only consultation. So there are times when we can either go off video and save bandwidth, or we can actually do a telephony based consultation. And, there's still going to be some of those barriers. There are also, for elderly people in particular, there are still challenges in just using the technology. Again, even though it's much simpler than it was even during COVID, it's still cumbersome for some people, and it then starts to interfere with the patient experience. So whether we're talking about telehealth or tech-enabled tools of any kind that are for the patient, invariably we have to look at, are we eliminating friction in the patient-clinician relationship, or are we unwittingly creating friction? And in some cases with tech, because of some of these barriers, I think we're actually creating friction.
And that's really interesting. It actually makes me think a little bit about the last conversation that we had during one of our tech talks around cybersecurity, and this need to balance friction points when you're making something overly cumbersome, but as a result of all those friction points, more secure. And then what then the individual users are experiencing, and what that right balance is for them as users. You can make something incredibly secure, but ultimately, if it's so secure that it's that much harder for individuals to access or use, folks will not gravitate towards it. And that's really interesting. It makes me think of that point, what you just said. Like anything that has such world rattling impacts, the pandemic really did make us build a lot of this infrastructure rather quickly. A lot of it has held. We're hearing those conversations on Capitol Hill in a federal policy context, where some of our members, some of our congressional leaders are really interested in seeing some of those expansions in telehealth services continue, particularly in rural communities. To your point, David, I would be remiss if I didn't mention that I grew up in a community where oftentimes that connectivity was not there. And so I cannot imagine trying to add like digital doctor's appointments on top of that. I don't think that would have worked. I don't think I ever watched a Netflix anything until after I moved away that wasn't buffering every 2 seconds. So it's difficult when we talk about adding these additional tools to that unstable connection. In a lot of our countries, still a large part of the United States still struggles with connectivity. And we hear that a lot as well. It's one of the areas we work on as an organization, expanded connectivity, broadband access. There are solutions in the works that are trying to tackle that, right? Balancing, existing fiber infrastructure, building off of copper infrastructure, moving towards fiber, adding satellite infrastructure where appropriate, where we can't really reach at kind of those last mile destinations, which is where I grew up, last mile destinations. But it is still a work in progress, right? With such a shift off of such a globally impacting period as a global pandemic, we have seen some permanent shifts. I'm so curious to ask you both. I'll start with you, David. What are those shifts that you've seen that you thought maybe were not permanent during the pandemic, and now kind of, I don't know if we can call it post-pandemic, but now that you are kind of fascinated by, that have stuck, or things that have shifted that you're fascinated by that have stuck now post-pandemic?
Well, one is that I think COVID, I would just say kind of at a high level, one of the things that COVID proved is it basically enabled us to understand what's possible operationally with telehealth and with some of these other technologies, not only what is possible from a clinical perspective, right? So, first of all, it really got a lot of healthcare systems to step back and say, well, we really need to just take a hard look at what requires a physical in-person consultation or exam, and what doesn't, right? Just at a very practical level. And I think we've subsequently learned a lot about the ability we have to provide high-touch, responsive care virtually. I mean, we see that every day in our clinic. And so I think another thing that has been an important realization coming out of it that has, I think, shifted things permanently is that telehealth in many cases isn't, again, as I said before, it's not just about convenience. It's actually a safety intervention in many cases, right? So, for example, if someone can remain in their home after chemotherapy treatment, radiation, where they are seriously immunocompromised, by virtue of staying home, they're actually reducing their exposure risk. It also enables clinics to provide or maintain a lot of continuity, right? And recognizing that in the past, if we wanted to have our eyes on patients over a period of time because we felt that they were at risk of any kind of serious adverse event based on what kind of condition they were wrestling with, we really felt like we needed to get them back in the clinic. Now we know that between treatments or between clinical visits, telehealth ensures that there is a high degree of continuity. In our case, for example, with cancer patients who we often see at the beginning of their treatment and as their treatment progresses, so they have a lot of clinical visits, but between those visits, a lot can happen. So we're able through telehealth to maintain what we clinically refer to as surveillance, right? We get to see how they're doing. We can see the setting that they're in their home life. In times, our nutritionists, for example, can have a patient open their refrigerator so they can see specifically what is it that they have, how is that potentially helping them with maintain or strengthen their health, or some of the things that they may be eating are actually diminishing their health. So I think those have been just subtle but really important learnings. And another that I feel has been a kind of real recognition is that more and more patients expect faster access to care. They don't expect it in terms of they're getting a visit with a primary care provider, because we now know that for so many people, they don't have a PCP. And if they do, those appointments can sometimes take months to get, right? Because of the shortage there. But when it comes to postoperative care or patients with serious conditions that do require a lot of monitoring, if you need fast access, telehealth is an incredible solution, and it does reduce friction in terms of being able to get in front of some kind of a clinician, whether that's a nurse practitioner or a physician assistant, or someone who can do some kind of an assessment to determine whether it might be important for you to now seek out care in a brick and mortar facility. Yeah. So those are some things that I think are kind of key sticking points. Yeah. They're lasting effects, I should say.
I think that paints a really clear picture. Interested to get your thoughts as well, Omar. I think it paints a really clear picture of the value add that this rushed integration during the pandemic has actually left us with, and that we should continue to build upon now. I think those conversations are starting to build, and that's really exciting to see. Omar, I'll open it to you if you'd like to add to that.
Yeah, so just to contextualize to today, right? Because we started from telehealth, and now we are in the AI era, right?
Hmm.
And that I think is a good framework to introduce a little bit of the work we're doing at EQ Healthcare. Because essentially we spin out from MIT, from the computer science department, right? And the research we were doing at MIT was essentially how can we build safety around AI systems, right? And what does it mean to be safe, right? To explain it in a easy way, most of us today, we're entering the wave of the chatbot. The chatbot, it's kind of taking over the world from the healthcare perspective, right? Because everyone is using it to check on symptoms, check on this or that. And none of these tools, right, ChatGPT or Gemini or any of these new wave of tools are approved by the FDA in any way or form to serve as a health companion, right? So if you read the terms of service of any of these providers, they'll say you can ask any healthcare question, but we're not responsible or in any way or form of what are the consequences of you asking healthcare questions to our systems, right? ChatGPT. So that's the problem we're trying to solve, right? How can we make AI actually give you the right answer in the context of healthcare, right? So what are the types of data that we need from you to answer the questions, right? Because we were going back again from the point of context, right? Understanding the patient, right? You cannot just ask, I'm kind of like, have this rush and hoping that ChatGPT will answer you exactly what your problem is. The doctor doesn't work that way, right? If you go to your primary doctor with some kind of problem, the doctor will ask you at least 10 questions, surrounding that problem that you have. Right. For us is how can we set up these tools to actually work reliably in health, right? Is right now a challenge. We don't have a system today that is approved by the FDA to be the general healthcare companion, right? For anyone. And anyone that is using it, they are kind of like putting their lives at risk because none of these answers are, correct to the extent that we
Right.
need it in health.
Right. I think
Right.
there's something interesting there because, even if, we continue to see advancement in some of those technologies, which we are, right, very rapidly, we know that as a part of the design for a lot of these models, these language learning models, they hallucinate. And so it becomes, a really serious question around, its application to healthcare. I would be lying, and I'll admit it here, if I did not say that I, was not using AI chatbots to ask about, what do I do if these are my symptoms? I feel like it is kind of the new WebMD to a lot of folks who are kind of curious about, what am I experiencing? I mean, heck, I use AI to change recipes. And my partner's allergic to eggs, and so I'm always asking, right, how do I make this without eggs, right? What's the structurally, what do I need to change here so that I get the same effect? But when it comes to the applications around health, I have heard this that, folks go into the doctor's office and they see their doctor pull up ChatGPT, and it makes them take a double take, right? Like, how are they using it? What are the parameters of use that should be appropriate or not? I have a question around that part, which I'm curious to throw out there as well, which is before moving into another part of the conversation. What are the concerns or the thoughts that our professionals in industry have around privacy? Because a lot of those tools also don't promise privacy. And our healthcare industry is one that's held to a very high standard when it comes to data privacy. So what are the thoughts there? What are folks hearing or saying or doing in practice?
Well, it's a really important question because, as is often the case, I think that we see technology ahead of where we are with respect to laws, regulations, and things that help to create a governance structure around the technology. And, you're right, Jose, that there's been a lot of attention paid to privacy in healthcare specifically. I mean, it is how we got HIPAA and a number of other, provisions in place to try to better protect patient privacy. And yet there aren't many days that go by when we don't learn about health-related data that's been collected through, any one of countless different health-related entities being sold without our permission, and being sold with the intent of enabling companies to target us with ads or any kind of messaging that speaks to our conditions. And I think it's a little disconcerting that just in this last week, the federal government under this administration essentially preempted states from being able to impose regulations related to AI for fear of how it may impact competition. And yet, I think it's likely the case that there are a number of states out there that are interested in trying to actually be much more thoughtful, innovative, proactive in ensuring that with respect to AI tools, there are stronger privacy protections in place. And so, I don't think we really have our heads wrapped around collectively. We don't think we have our heads wrapped around the implications at this point of how much of our data is being captured today in an even faster way through AI, and how that can be reused in ways that some of us would prefer it not be. And so I think from a regulatory and policy standpoint, we're probably far behind where we need to be. And there's seemingly, in many cases at the federal level, not a lot of political will there to try to figure out how to head down that path.
Yeah, this seems like an appropriate time to flag this kind of next section of our conversation, which focuses around tech innovations that are helping individuals kind of facilitate their own monitoring and in their health. We talk about wearables quite a lot, right? Apple Watches, Fitbits, I think they're called Aura Rings, that track your sleep or heart rates or, a number of things. Those are things folks wear on a daily basis. But then we also have these new technologies that are being integrated, AI tools, in clinics, in the doctor's office, that folks are starting to see and expose themselves to. There is a conversation around, what is done with that data? What are the parameters that we're setting? What are both our medical professionals comfortable with, but then also the patients comfortable with, as we're facing so many challenges, worker shortages in industry that move us in the direction of wanting to look at some of these things that add capacity or, a bandwidth for processing information. And so it's a thing to juggle. I'm curious, as we move into that part of the conversation, to ask, what are, or better put, how have wearables changed the way individuals engage with health data when they go into industry, when they're engaging with medical professionals? Are they bringing more information that's valuable? Are they more self-aware, I guess, of how, what's been the interaction there for industry? I know startups are all over this space, right? But from a patient standpoint, I will say I walk into the doctor's office and I'll sometimes say, my watch monitors my sleep. I've not been getting good sleep. This is what I can share. I don't know if this thing is right or not. Sometimes it says I'm like sleep in 2 hours, and I know that's not right, so I don't know. But what's the experience there from the industry side?
So I can talk a little bit about our work in this space. So I would say that wearables are essentially the next wave in healthcare, right? That's why we have so many startups and why there is so much interest. The problem is that the healthcare of today is not built for that, right? We're again
Mm,
in the same problem of, we have this healthcare system that is more reactive, right, than active, right? So you need to ask your doctor or say, I'm having this problem, and they help you, because for example, we are building a lifestyle intervention with AI, right? And
mm,
if you talk to any physician and say, look, there is this cool technology, it's about lifestyle, it's going to help to understand your patient, they'll essentially tell you, we don't need you, you know,
mm,
because you're more of a burden as a startup, to them than
mm,
helping them, because they essentially make money. Most of the doctors today make money by charging coding, so each of the conditions that we have, you go to the doctor and then they look it up in the list of conditions of the codes and they charge the codes to the insurance, right? And that's how a hospital or a physician makes money, right? And if you go with all this cool information, data, they'll say, okay, so how I charge that? How is that helping me,
mm,
right? So, and that's how it connects with this new model called value-based care. This is value-based care from the point of view that instead of fee for service, where you can like go and get your appointment and that's it, you are more or less in time, see that you're in good health instead of in bad health. And if you are
mm,
in good health, like the hospital, the physician gets rewarded more because you're in good health, right? So that's a new
mm,
model, but it's very challenging. The model has been around for so long, but I would say that is not getting traction because it's extremely hard to implement. It's extremely hard to measure. It's extremely hard for the physicians to charge, to know. So I would say that it's more of a vision rather than an application in today, right? So, but I
mm.
think that we're getting into more of the chronic disease, right? So David, probably he knows a lot from the cancer perspective, right? How this is has an impact there. But yeah, I would say that value-based care is kind of like the model that connects more with these time domain
Mm.
signals that we have of the patient. But the system is not built for that. So we need a lot of innovation, a lot of regulation, updating policy, that
Mm.
allows this to work more efficiently.
Interesting. David, I'm happy to give you the floor as well if you want to add to that, but I have a couple of questions there myself.
Well, there are a couple of observations. I mean, one is that these devices, of course, are capturing a lot of information in real time, but that data that is really only valuable in the context of healthcare, right? It's only valuable if it actually changes or informs the delivery of the care. And I would argue that, and I find wearables to be incredibly exciting in terms of patient care for a number of reasons. But I believe that up to this point, I would argue that they've changed patient behavior or consumer behavior more than they've changed medicine, right? I mean, we are using them more and more to get sort of insights, as you pointed out, right, into sleep. How much am I sleeping? What is the quality of that sleep? How much activity am I actually, how do I have in a given week? How many steps am I taking? And how is that potentially affecting my heart rate? Or are there relationships here with how tired I am, and so forth? And so there's still, I think, a big opportunity ahead to figure out how to create relevant sort of clinical context to the data that we all have in these different devices. In other words, what if I'm a doctor or a clinician? What does this tell me about how a patient is trending with respect to managing, their symptoms, or What are the signals that we could pick up in a clinic from these different devices that perhaps alerts us to someone who could be on the threshold of some kind of a health crisis, and enables us to intervene faster. So, interestingly, just today, in fact, or within the last couple of days, United Healthcare made a decision that it was going to only cover a couple of different or a small number of chronic conditions and reimburse remote patient monitoring, which has long been considered to be an incredibly valuable way of using some of these tools, right? To get insight on the clinical side as to how someone is trending, and provide a much more earlier intervention that not only can improve outcomes, but on the payer side, presumably can reduce unnecessary utilization and cost. And yet United Healthcare is saying, we're going to reimburse primarily for, I think it's heart disease or diabetes management. But outside of that realm, we're not seeing sufficient outcomes data to persuade us that we should reimburse clinics or companies for using these kinds of devices. So they can support a lot of monitoring that can be very valuable, but ultimately the data has to be actionable, partly in order to get it reimbursed, but partly in order for it to really have the impact on outcomes that I think we all want to see.
Interesting. That's really interesting. I think it's not surprising. I think I do see that, the value of these wearables really depends on the way individuals are using them to maybe change their health habits, exercise habits, eating habits. Every now and then, when I want to get a sense of, am I eating too many carbs, or am I eating too much processed food, I'll start tracking some of what I'm eating. I know that some of these things also then create unhealthy habits or unhealthy behaviors, particularly with vulnerable communities like children, right, who maybe develop or are more prone to developing some of those eating habits as a result of being overly managing of kind of what they're consuming, or over exercising for some folks. So I think there's a conversation there around how are we creating healthy habits with some of those technologies. But certainly I know I would say I've benefited from some of those. I don't know what I need to start wearing to better track why I keep getting sick, but I will, I will try to keep an eye on that myself. It is interesting. And I will say, I also get really excited by those technologies. One of the things that I am just always really fascinated by is the way that some of these are bridging accessibility gaps. Fascinated by the fact that we have headphones now that kind of help serve as sound amplifiers. You can do hearing tests on them. I've heard mixed reviews of how good those hearing tests can be on these devices. I have a pair of smart glasses as well. Those are great for folks that are visually impaired and need some assistance there. I don't know to what extent, but we are seeing some of these technologies start to bridge these gaps in accessibility, which I think is really fascinating from a public health perspective. I'm curious, as we're looking to kind of look ahead, look forward, and bring the conversation to a close. What are you all keeping an eye on today? What are you looking at as leaders in industry that you're saying this is something to watch, or I'm keeping an eye on this because I think this is moving us forward next? What's that thing that has your attention right now that you think is the next kind of leap forward for us in health and tech?
I can say a few words. So I would say that the most inspiring thing for me, if you ask me what is your what do you wake up every day and do your work, I would say that personalized medicine will probably be allowed. So it's extremely hard, to personalize medicine. There are so many factors, and there are so many different um, conditions, or selves are unique. So for me, it's how can we personalize the experience of the patient? right? And I believe that we might be now have the tools to do so, right? Because in the past, just to put in context of what you said, right, of the iPhone and all these new devices, most of the devices, right now are more or less dumb, you will say, because they can do some of the data analysis, but still they're not intelligent enough, to tell you, as you said, what's going to happen to you tomorrow, or what's your trajectory, right? So I believe that the intelligence layer to enable personalized medicine is still missing. It's still missing to really provide, as I said, guidance to the user that is safe and correct and that understands the context, right? And just imagine how hard that will be for the hospital system. Unless you have at least some of my family members have doctors that have stayed with them for their whole life. And that is a particular scenario because you more or less your doctor knows you, right? And that's great because you have spent the life with that doctor. But I wouldn't say that that's the case for everyone, right? So most of us change where you live and change doctors, and that is kind of you need to have your own information and kind of like self-manage yourself because you are you own your own life and you control your health. And I believe that you should be more um, you could self-manage better your health, and I believe that we are close to do that, right, in a safe way, and that's at least what excites me.
Does that then shift the health, I guess the health space that we have or that we're thinking about from reactionary to more preventative? Is that
Yeah,
then kind of
exactly.
in
So
line with
so
okay?
yeah, so I would say that's more like health span than
Okay.
increase of health span, like longevity, right? So that is a question that is not answered today, right? It's very hard for us to live longer healthy, because
Yeah.
chronic disease, it's any kind of chronic disease, dementia, obesity, cancer, all these problems are exponential now, right? And I would say Medicare is kind of, it's going to explode. It's going to explode because we're getting older and we're getting sicker. So how can we solve that, right? So I would
Yeah.
say that at least it's an important problem that we still not have a
Right.
solution,
Mm.
right?
Yeah.
From my perspective, the thing that I'm looking at in the future that I hope will take hold is really more about what is the appropriate sort of hybrid solution that is going to work really well for consumers and patients and providers, right? I think that the future isn't virtual or physical, right? It's coordinated care. And as we get more sophisticated and we learn more about all of these tools that are now a part of our this amazing ecosystem around us, it's a question of where do we use these tools? How do we use these tools to sort of rebalance, in a sense, our use of care and how we engage with the system. And so, for example, I think with things like diagnostics and certain procedures and acute events, that's going to continue for the foreseeable future to be in-person, in-clinic care, right? Setting aside that we can mail order lots of different diagnostic kits, in order to do everything from, of course, do genotype kind of profiles or, early cancer diagnoses and things or detection. But setting that aside, I think that the model will really ensure, or hopefully will ensure, that we're using these tools to strengthen longitudinal support, meaning over time we have more insight into how patients are trending and where they're trending in the direction we would expect them to, or on the contrary, there are signals that indicate they're really losing ground. And that's the thing that we're looking to, for example, in our clinic, we use patient-reported outcomes data, for example, across longitudinally in order to see as someone is progressing from their diagnosis to treatment to post-treatment and beyond. The patient-reported outcomes data, which are digitally captured, give our clinicians a lot of insight into, is this someone who's doing better or doing worse? And if so, what does that tell us about the most appropriate intervention or support that we can provide to them? I think that the biggest risk ahead with the sort of increasing ubiquity of a lot of these tools for monitoring, like wearables and remote devices, et cetera, is the risk is that we do create more fragmentation instead of less. And so I think we've those of us working in healthcare have got to, first make sure that we're prioritizing, equity of access to the technology, and that that there's a focus on literacy and so forth. But second, we really have got to ensure that there is this clinical integration that enables us to have the data we need when we need it, and know how to respond. And then, I will say, last but not least, the reimbursement models, right? I mean, hopefully, to Omar's point, with value-based care or other payment models, more and more, it's going to be a function of outcomes and how we can help people hopefully avoid utilizing care when it's not necessary, by virtue of having been much more proactive with all aspects of care.
Yeah, I think that's an excellent point, and it certainly is the responsibility of folks that are leading in our industries to help in that collaborative curation of care as we continue to move forward with so many of these innovations. We have a couple of really interesting questions here that I think would be great to speak to. The first one, a little bit more broad, I think, happy to open the floor. How do we address concerns in industry or around automation with folks, particularly younger folks, looking to come into these spaces, healthcare spaces, who are concerned with automation? I think we've heard some of those whispers already in some of our technicians, where we're seeing a thinning or a threat from the way AI is being brought in to look at some of the things that are happening in the doctor's office. So I don't know how to answer that question. I'm curious myself. Like, how do we speak to young people that are concerned with automation but want to move into these career spaces?
I can give a short answer. Maybe also David could complement. But just to put the answer in context, in AI we have a pioneer called Jeff Hinton. So he essentially built the revolution that the revolution that we are in today with neural networks, and he said in 2012 that radiologists will be replaced. That was his statement. So we are more than a decade after that statement, and I would say that radiologists are not replaced, and they're actually demanded. There is the demand that is not solved with the current system, and the point here is that the fear of automation is always there, right? But I would say that healthcare is such a challenge that even if you build the best tool and technology, will never replace a physician, which is more or less one of David's points. How can we achieve this hybrid, right? So the future is hybrid, if you like it or not, because we already tried to automate it in the past, and we realized that it's almost impossible, to automate something like healthcare. So I would say that it's more like a copilot, right? So how can we build the best copilot for physicians? Because their work is challenging, they get burned out. And for example, there are these AI scribes today, right? So the AI scribe is that you go to the doctor's office, and there is this phone recording the conversation. They don't have to type, right, or everything that happens. and that helps the physicians, right? And now we have thousands of AI scribes companies, So I would say that things like that, right? We know that work, and it's more or less kind of helping the process rather than just eliminating the role on its own, right? Because history is saying that that is going to be impossible. So if you are a young person thinking of entering the healthcare space, think more about how to use the tools for your job rather than being afraid to be replaced, I would say.
I think that's a great point, and I would add that because of the hybrid, future that we're talking about, the likelihood, to Amar's point, the likelihood of clinicians being entirely replaced strikes me as very low. I'm sure there are plenty of people who would disagree with me about that, but one thing that seems very evident in this country is that increasingly, whether we're talking about oncology, primary care, or any one of dozens of other healthcare professions, there is a real shortage of care providers, and that problem doesn't really seem to be going away. And in cancer care, for example, there are a number of companies that are, really very much a digital health solution that are using things like chatbots to connect with patients, to essentially gauge how they are doing. In other words, they're using chatbots in place of an individual to check in and say, let me know how you're doing, because that enables those technologies to get the information they need from an individual in order to essentially provide do triage, right? To determine whether this is someone who's, based on what they're telling me, with telling the bot, right, with respect to symptoms, using, kind of these rules-based decision trees and so forth, it will enable them to determine whether this is now an individual for whom those symptoms can be managed by sending a quick text link to a document or a video that tells them how better to manage, their symptoms, or on the contrary, would actually then connect them to some kind of provider in person or virtually to provide them with the kind of care and support they need, or advising them to come into the emergency department or something else. So again, you see this model, it's not an either or proposition. And I think that for, certainly for the foreseeable future is going to be a very viable model and way of thinking about where there are needs for jobs that aren't going to go away, and where they sit alongside these technologies that are obviously really first and foremost about automation and efficiency.
Yeah, 100%. I think that sheds quite a bit of light for folks as we hear more and more young people's concerns that there is this threat of automation in so many industries at a time when the workforce is turbulent for so many of our recent graduates. I really, truly appreciate both of you making the time to have this conversation today. I think this has been really insightful and certainly provided some context for folks who are looking to better understand how, as an industry, we're seeing that that innovation at that intersection of health and technology. Would love to give you both the opportunity to provide some closing remarks, but this has been a wonderful conversation.
Yeah, thank you for having us. I'm really glad we could be a part of this conversation. And I want to say that I'm looking at so many of these questions through my lens as a chief operating officer, and I will admit, if I'm being honest, there are a lot of answers I really am still struggling with along these lines. I think that there's a lot of complexity. There's always a lot to unpack. But, I've been in the digital health space for almost 20 years now, and I find that for me, just the overarching question that we need to be asking is this a technology that reduces friction for patients and clinicians, or is it potentially adding to it? Right.
Right.
And I'm convinced that we've made incredible progress. And I think part of the reason for that is because things today, like telehealth, for example, is proving to be more successful than ever because it's kind of just sort of disappearing into the background, right? And it's not as cumbersome or as intimidating as it was when it was first rolled out. And now, if it's in the background, it really enables our clinicians. We see it daily. It enables them to focus on care and focus on the patient in their home. And that's a real win. So my hope is that whether we're talking about telehealth or any of these technologies, that they sort of fade into the background and enable clinicians and patients to have even better conversations about how to address whatever the concern is that they're dealing with in that moment.
Yeah, 100%. Well, I want to thank you both for an incredible conversation. So excited to continue to stay connected on this work and see what continues to build in DC from industry all over the country. I think certainly this is just the beginning. So I want to thank you both for making the time. And until next time, thank you, everybody.